I'm here to review you just some basic tips on using the Waterpik. Generally, you're going to use either your standard classic jet tip or your pickpocket tip, which is my favorite for periodontal disease. How this is going to differ from your normal jet tip is your pickpocket tip has a nice soft rubber tip on the end that makes it really nice for going down below the gum line or within what we call furcations or spaces in between the roots of your teeth. Your classic jet tip is great to replace more flossing, and with this you're going to get a higher pressure, but you can aim it directly in between your teeth and really flush out if you have a food tract area. When you're going to use your pickpocket tip, if your practitioner ever talks about periodontal pockets or deep pockets or bone loss, this is going to be the tip for you. And how you're going to use this is you're going to keep the tip more parallel to the tooth, and you're going to just gently slide it down below the gum line into the pocket or within a furcation or the bone loss area and flush it out. And you generally just take it and scallop it along the edge of the gum line. If you get to areas where the tissue is tighter or healthier, you're not going to be able to take this tip up and below the gum line, so don't force it. You're just going to gently take it and scallop it along the edge. How you're going to start off using your Waterpik is there's a reservoir here that you can take out, and there's a lid. You're going to fill this up with warm water, or sometimes your practitioner might recommend you use a medicated rinse. They may recommend that you use it with part warm water in your favorite mouthwash. The only thing you don't want to use in this is salt water, because your water will evaporate and the salt will clog up the line. So pretty easy to place on there. You have your basic on and off switch, so you'll turn it on. This controls the rate or flow of the water. So you always want to start on the very lowest level. And your liquid's going to start flowing up through here, and then you have a nice pause button. So you can pause it, get into the mouth where you want it to go. So keeping it on pause, gently insert it up under the gums, unpause, and let it flush up underneath. If you feel like the water pressure isn't enough, that's the time when you can then increase the pressure. And those are your basic rules for starting your Waterpik. As far as angles, it's always best when you first get your Waterpik home is I just put the tip on there and practice what it feels like in the mouth, practice some different angles. Then I would fill it up with some warm water, do a practice run. Getting around the outside of the teeth and then front is usually the easiest area. Where you're most likely going to run into problems is going to be trying to get the inside, because when the water's going and you can't always see what you're doing. So I have found that the easiest way to get the inside is to come from the opposite direction. So if you're trying to get the inside of the right molars, I would come more from the left and go right over the tongue. And that's how you're going to be able to access those a little easier. Same thing with the top. To get upper right, I would come from the lower left and go right up across. But again, I would take this, practice with it first without any liquid, get it down, feel what the tip actually feels like when inserted down below the gum line, and then try it with the liquid.